Hospitals and health systems are committed to helping the members of their communities live their healthiest lives. This includes ensuring that patients have access to all of the information that they need when planning for their care, including estimates about what that care may cost them. The Hospital Price Transparency Rule, which went into effect on January 1st, 2021, has two main components. The first is often referred to as the machine-readable file, and this is a requirement that hospitals publicly post 5 standard charges: gross charges, payer-specific negotiated rates, the de-identified minimum and maximum payer-specific negotiated rates, as well as discounted cash charges. The second part of the rule is referred to as the shoppable services component, and this is where hospitals either have to offer an online cost estimator tool or provide payer-specific negotiated rates for the 300 most common shoppable services. Hospitals are working hard to comply with the rule, and we're proud that the Centers for Medicare and Medicaid Services has found that 70% of hospitals are meeting both requirements and that 80% are meeting at least one. This is particularly true because January 1st, 2021, the date of implementation, came during one of the most challenging times in the history of the U.S. healthcare system. The preceding 9 months, the time in which hospitals were really needing to prepare their price transparency tools, was when they were dedicating all of their resources to combating COVID-19. In fact, on January 1st, 2021, the date of implementation, that was the start of the month where, up until that point, we saw the highest number of hospitalizations and deaths from the virus. The hospital staff helping to respond to the COVID-19 pandemic were the same that were needed to pull together the price transparency files and tools. And creating these files and tools is no easy feat. It requires pulling millions of data points from hundreds of different payer contracts for thousands of different services. In addition, on January 1st, 2021, we were still awaiting federal guidance on how to interpret all of the rules. For example, what to put in a rate cell for bundled services, or whether blank cells were appropriate if a hospital didn't offer a service, and finally, what to do if the rate varied based on volume. Hospitals will continue their efforts to implement the price transparency rule, as well as comply with all other state and federal price transparency efforts. And we look forward to continuing to work with policymakers to ensure that patients have access to all of the information that they need when planning for their care.